Okay, everyone, welcome for another Rehab to Go. Now, this is my first attempt on Zoom, and I hope you guys like this setup. I was watching my kids do their homework as they have to be home, for the coronavirus, and everything was on Zoom, and I'm like, this is the thing I'm looking for. This is the way I can do my lectures while still having my personality in there and be able to show you a couple things. So the common sports complexes, this is a lecture that I put on all the time for my athletic trainers. I do it for doctors' offices. I do it at hospitals a lot of times. This is one that's probably best built for practitioners, but it's for anybody. And why I picked low back pain as my first one is because my office has really been decimated, just like everybody on the planet has with this COVID virus. This is about all that's coming in the office anymore. And the phone calls that I'm taking are like, hey, doc, I've got severe back pain. And I just want to explain how we can all do a better job. Because all of you guys that are at home right now, you're getting these phone calls. Low back pain is about the number one thing that anyone will ever report to the ER for, other than these major things that are happening right now. So no one's going to the ER for this stuff anymore. They're calling their friends and saying, hey, what's going on? So I hope this comes off the right way. I would like to do a lot more of these. I can do them on plantar fascia. I do them on hamstrings. I have hundreds of these lectures put together. I just haven't had a good way of sharing it on YouTube and stuff now. So I hope it works. If you guys need to see some more chops on me, I'm trying to make these videos around 10 minutes long. I don't want to go on and on. If you want to know who I am, go to the drchadpeters.com website. It'll go over all this stuff. You can see, do I have the chops to talk about what I'm talking about? For most of you guys that are following me, you know who I am. We don't have to get into this all the time and go through it again. So whenever I put together my Rehab to Go or common sports complex ones, especially for university athletes and athletic trainers, I'm always going to go through these common setups. We're going to go through the presentation. So if it's not an athlete's presentation, it can be a client's presentation or a patient's presentation. MOI is the mechanism of injury. We're going to go over how to evaluate it and why we do it a certain way. And then the next stage is distinguishing tests. Now there's 100 tests that you can do, orthopedic tests and otherwise, for nearly any condition. There's all kinds of screening tools, but there's typically 2 or 3 things that are the slam dunk that change my decision making. When I see these things hit, I know that this is what's going on and we're going to proceed this way because it's going to hit for 99% of the things. There's expedited treatments. I think this is one thing that our clinic does very, very well. We get patients and clients better, faster, and the reason is the why. We do things a little bit different. I'm going to go over DDXs, which are differentials, things that may be going on that maybe we're not thinking about or we should be thinking about, and also mimic conditions. And then I'm going to go through your expected outcomes, because you guys need to be able to present this to your clients and to your friends and to your mom and say, here's what to expect if you do stuff the right way. So the one caveat I want to get into before we really get into this stuff, and I preach this a lot of my podcasts have been on this thing. I feel like as doctors in the US, but in the worldwide area, and I don't care what kind of doctor you are. I don't care if you're actually a doctor or not. If you're an athletic trainer, you're doc. I called all my athletic trainers doc. If you're a practitioner and you're working on people, we need to do a better job of being a detective. All right. I think the world is getting bad where things like, hey, doc, it hurts here. Oh, that must be carpal tunnel. Hey, doc, it hurts right here. Well, it's got to be a sciatic issue. I mean, can we do a little bit better than that? Can we use clues? Can we make our exams real life so that we can make better decisions? And that's what an exam should be. An exam should not be, hey, let's make sure we do these 5 things so we can fill out the boxes so the insurance pays. Exams are where we're fishing and we're looking to see what comes up and we're looking for clues. So think about that as we go through this stuff. Can you become the best detective to help your people get better faster? We're all looking for clues. And where I think most of the mistakes are happening in our treatments or common treatments that are out there is because we're not paying attention to the clues. We'll get into it. It should make sense. The only one I'm going to cover today, the first one I'm going to try with the Zoom, is the low back pain, because this is what everyone's coming in here for. This is why I'm getting phone calls. Hey, my back is killing me. What can I do? This presentation for the most common one, what we call a disc torsion or a disc strain, is severe spasm. So you'll have your guys coming in and they're like, oh man, it hurts here. It hurts here. They'll even make the grumpy old man voice like that. They're kind of leaned over to the side, right? They've got this antalgic lean, typically leaning away from the side of pain and a little bit forward, but it doesn't always have to be that way. But you're going to see that most of the time, the lean away and forward. Changes in position hurt. I go and get my patients out of the front room because I want to see how they get up off the chair. If they have to put their hands on their legs and push up, oh, yeah, no, that's it. Now I can move. Or they have to grab like the handles of the chair. That is a positive minor sign. It's a change of position. Now I have huge windows in the front. Sometimes I get to see these people get out of their car. But if not, you have to ask them, does changes in position hurt? Especially getting out of bed first thing in the morning. When you get out of bed in the morning, does it hurt and you have an old man walk where you're slightly forward, and after you get moving for a minute or two, you kind of get up and you're moving around normal? Yeah, it's funny, Doc. It really hurts when I change positions. And that old man walk, that seems to hit on a lot of people. What has happened is they've got a pressure issue on their disc. When they're laying in bed, they basically have no gravity working axial load. So they sometimes can get to where they feel pretty good if they don't have too much of a spasm. But when they get up, they have changed position, and now there's gravity pushing on them. The one where this really came to light, 2 decades ago where I made my decision, is those inversion tables. These people with hot low backs will get on the inversion table, and it will feel great. It stretches them out. All their discs open up. But when they flip back around and it reloads, it almost breaks their ankles. It kills them to change positions. And because of that, it changes the way I do my treatments in my clinic. If it hurts my patients to get out of bed after laying down, getting to a seated or standing position, it kills them. Why on earth would I lay them down in my treatments? I keep them seated. Now, every one of these guys with sore low back will tell you it hurts, but it hurts way less getting up out of a seated position than it does from getting from a lying down position, especially laying prone, where you can take almost all the pressure off their back, and they're going to tell you, oh my God, this feels great. This feels so good. This is the best I've felt. And then they can't leave the table. On these hot lower backs, these disc strains, my massage therapist in my training room, and when I do continuing ed for massage therapists, I push this all the time. This is a career killer for you guys, because while you're doing a massage on these spasmed hot low backs, that person is going to tell you, this is the best I have felt for a week. This is the only thing that's giving me any relief. And then you walk out of the room, pat yourself on the back for a good job, and they're stuck there naked on the table and they can't freaking move. They're that stuck. So make sure you're not laying these people down. They've already told you, they've already given you the clue. It hurts when I change position, especially out of bed. Why would you do it? You may have radiation down one of the legs or into the butt or around to the front side, sometimes into the groin. I see that on females more often than males, but it's not always necessary. The problem is you can hardly get to this presentation because the patient and the athlete and the client is just going to tell you, it hurts here, it hurts here, it hurts here. And as you start getting into the testing, they're going to interrupt you and be like, Doc, I don't know, it just hurts. It hurts. Everything hurts. It hurts right here. These are severe. This is the disc strain. Now, it's not the same as a disc herniation, but the disc strain. And we'll talk about that. The Valsalva is my #1 biggest diagnosis tool after the change in position. So COP right there on the handout right there is the change in position. Valsalva is next. Now, I learned Valsalva, bear down like you're constipated. That meant nothing to me, all right? Or like you're trying to blow up a balloon and it won't blow up. That doesn't mean anything. I tell my patients, take a breath in, hold your breath, squeeze down. Oh, yeah, no, that hurts. I can feel that. When you cough and sneeze, does it hurt? Yeah, no, that hurts. That's Valsalva. And that has to mean something. That is not a muscle spasm. The spasm happens because something is happening internally. When you do Valsalva and change in position, you are leaning towards a distinguishing test saying this is something happening in the disc. And then add to the next one, do anti-inflammatories improve your condition? Hey, if you pop an Advil or an Aleve, does it seem to take the edge off? Yeah, it does. Some people have great results with this. Some people will tell you, no, it doesn't really work. And some people just don't take it. It's no big deal, but that's one of my clues. Do anti-inflammatories help? And if they say, yeah, it helps, well, guess what? Advil and Aleve doesn't have pain relievers in them. It has an anti-inflammatory. So if they take an anti-inflammatory and it gives them some improvement, they are probably inflamed. So don't do things like massage and your car seat heaters and a hot shower and a hot tub. I get there's muscle spasm there, man. You've told me 100 times. They're leaning to the side. They're telling you it's a hot muscle. And because we're practitioners that like to use our hands, we're chiropractors and PTs and athletic trainers and physios and DOs. We love getting our hands on people. We can feel the spasm. Heck, their wives can feel the spasm. They know it's a muscle spasm. But I want to explain it to you. We know that the spasm isn't the primary thing. We've just done these 3 distinguishing tests, and it has told us there is something happening internally. So here's how I explain it. If you sprain your ankle swells. That's the body's response to being on threat, which is kind of the new sports term. Things are on threat. When this happens in your back for a rib issue or a disc issue or a facet issue or something along your spine, there are all kinds of nerves that come out of your spine. The body doesn't want to swell and put pressure on one of the nerves. So the body's response is we're going to lock these muscles down as tight as we can. That's where the muscle spasm comes into play. The spasm is a protection mechanism. And basically a disc strain is the sprained annular fibers. It's very similar to like what a sprained ankle would be, and at least the way I explain it, because it takes it where it's not so scary and they can deal with this. This is a common issue. Everybody has these things. Now, as we get into our secondary tests, do things like Bechterews, do your reflexes, do your heel-toe walk, and your muscle strength stuff. You have to have this, because if we're saying disc and you say that word to your client, especially like a superstar athlete, hey, we think it's a disc, they're going to freak out. Or they're going to carry this with them, this burden with them for the next 10 years of their career. And this is something that's going to be gone in a week. The thing is, you have to have some positive tests like the Valsalva, the change in position anti-inflammatories, and then they have to go along with negative stuff. You ask them, hey, can you walk on your tiptoes for me a couple steps? Can you walk on your heels a couple steps? If they can't do this, you better start getting nervous. Their neurological function is messed up, right? The heel-toe walk, that's a neurological thing. You're not sure? Take reflexes. They have reflexes on one side. They do not have reflexes on their other side. That has to tell you something, and you better start getting a little bit nervous. The one that I'm teaching today, this disc torsion or this disc strain, this is the baby version. The pain is the same as a herniation, but the mechanism is different. And we know that because our heel-toe walk, our changes, our reflexes, and our muscle strength. We're going to test the muscle strength of the lower extremity. When those are all normal and your primary thing is these 3 tests here with pain, you're not dealing with a disc herniation. This isn't something you have to send them out for MRIs right away for, nor is it something that you have to tell them you should expect surgery. And that's important to say that to them, because when you say the word disc, they're all thinking of their grandma sitting around saying, oh, my low back, it's killing me. It must be my disc again. It must be my sciatic again. Make sure you tell them that's not how it is. The differential diagnosis, the distinguishing tests that I use, not differentials, excuse me, the distinguishing tests are the Valsalva, the change in position, add to it the anti-inflammatory. When those 3 things are positive, it is a slam dunk. All right, how do we treat these things? We now have this new term, it's this disc strain, and we don't think it's a huge major thing, it just causes a ton of pain. I like to use my electric stim. I still think those are really good to use, and I use ice with this. It's an inflammatory condition. If you are doing things like deep muscle stretches day 1, if you're giving them rehab exercises, if you're doing massage, if you're doing a hot pack, car seat heaters, sit in a hot tub, long stretched out stuff that brings blood to the area, when blood comes to the area, it feels better. They will tell you those things help. That's what they've been doing at home. That is the wrong treatment. It is an inflammatory condition. You better treat it like it's inflamed. And in our office, we kind of chuck around between the other doctors in the clinic. Is it the use of ice that's the big thing that really helps speed these guys up, or is it just not using heat and keeping it irritated? In my estimation, like, why not do both, right? I'm a chiropractor, so I do want to move the joints. So if they can tolerate it, which almost everyone can, especially on a drop piece, we do pelvic, sacral, lumbar motions. And what you'll almost see is the sacrum is rotated one way and the lumbar is rotated the other way. It's almost like you're taking a dish rag and wringing it out, and your disc is what's getting wrung out. Those annular fibers are under stress and they can strain. That's why I say it's like the same mechanism of an ankle sprain, right? It's just annular fibers that have stretched a little bit. There's no reason to rush to get an MRI because these guys are gonna be better in a week anyway, all right? As long as the neurological things are good, we're gonna progress like it's a disc strain. Now, I'm not telling you guys how to be doctors out there. You have to do your own decision-making. But if I have worked on these guys, well, we'll get to that when we get to treatment stuff. But if I've worked on them for a week and they're just showing absolutely no improvement, or if they get a lot worse, then we always go get the MRI. I mean, we know there's probably something happening internal. It's a disc. If it doesn't improve, you better hope it's doing something else. When I see guys that are, I had this low back issue. I couldn't get out of bed, and this went on for, I saw this chiropractor or PT for 30 some visits and they never got an MRI. I'm like, you guys are out of your minds. Like, this thing should be better immediately. This isn't something you should treat all season long if you're an athletic trainer. A lot of times I see people being treated for this hot lower back all season long. It's because they're doing heat. They're stretching them out. They're trying to do everything to keep the muscle stuff going. Remember your clues. The muscle spasm is a protection mechanism. The lower back is on threat, right? Take the threat away. There's no reason for those muscles to stay spasmed. All right. Now, note the lack of my taking the tools and just scraping the crap out of it. I'm not doing anything that will bring more trouble there. I use those tools in my clinics all the time. I love them. This isn't the time to do it. This is stage one, get them out of inflammation. That's how people get better faster. That's why the people get better in my clinic. These almost always are 3 visits over the course of a week. That's how it works. It's very simple. What are my DDXs and what are my mimicking conditions? Well, you better worry about a disc herniation. Now, my differential on that is that my reflexes, my muscle strength, and my heel toe walk were all negative. Those all tested out fine. So we're not thinking that first. We're thinking a low-grade strain. We also worry about a fragmentation. Is there a chunk of that disc that has broken off and now is sitting sometimes on a nerve, sometimes not on a nerve? An MRI will show that for you. But at least do 3 trial treatments in the lack of neurological signs before you would say, hey, let's get out there and rule this thing out, right? One of the other things I see here is shingles, right? People are stressed out right now. It's a high anxiety worldwide. I'm stressed out right now. Shingles will start to show a lot more because our systems are stressed, right? Muscle spasm is what I typically see people diagnosed with this. Hey, Chad, I've been around the block on this thing. I've been to a couple different doctors. They think I have muscle spasm. Look, man, it's in the spine. Muscle spasm has to be coming from somewhere else. It's not just a spasm. They could also have kidney issues. They could also have a UTI. Look for these things, rule them out. This is the way you treat them. Keep them seated, throw the ice on there. The big thing going back to it is right there. Third thing down, education is my priority. People have to know what they have on this thing. If you cannot explain this well and you're going and saying, hey, I think you got a slipped disc, you're very 1990s. You've just aged yourself and you're behind the curve on where we're at. This thing is called a disc strain or disc torsion, or called it a hot disc is what we used to call it when we worked with the athletes back in the day. I don't care what you have. Take some time, explain these with your clients. This will make you better than the guy down the street, and they're going to come back because you take your time to explain it. Expected outcomes, 5 to 7 days. This thing nearly always takes a week. I really don't get a lot of these like, oh my God, he popped my back and it was perfect in a day. It just doesn't work like that. If there are fibers that are strained, even if I put everything back in the right position, I do my chiropractic magic and everything goes back in the right position and there's no more stress on there, it still takes about a week for those fibers to start kind of rehabilitating. And that's why the ankle sprain analogy helps out, because your patients can deal with that. If you don't give them something to latch onto, they walk out of your clinic, they're like, I don't feel any better. Look, no one's going to feel better when they walk out of your clinic with this for the first visit. What they're coming in for is the information. You need to teach them what they've got so they can get better. 5 to 7 days if treated correctly. That's how it is. I typically see them 3 times in my office and I give them the education. They start treating themselves the right way. Most of them will lapse because a hot shower just feels super good. And I just tell them you're doing the opposite of what your inflammation stuff is, right? Now, at the end of the day, I'm not cruel. You don't have to take a cold shower. At the end of the day, you work out in the oil fields, take a hot shower, man. Just don't turn around and let that shower blast on your lower back for 10 minutes. And I also use that as one of my teaching tools. Hey, when you take a hot shower, does it relax the muscles and feel really good? And it gives you like 10 minutes of really great, and then you can't tie your shoes anymore? Yeah, you've just re-inflamed an inflamed condition, and the body's response is, holy crap, something's wrong. We better tighten up everything again. And that's why you get in this consecutive loop of this where it doesn't get better. Guys, that is my disc strain, my hot lower back, my first time on Zoom. I hope you liked it. If you want more of these things, you let me know what you want to go over. I am happy to discuss these both as a patient and as a practitioner. This is what I wanted Chad Knows to be about. I hope it's what you were looking for, guys. You just finished another Rehab to Go. I know you learned something. If you want to know when the next one's coming out so you can be ready for it, all you got to do is subscribe. Hit the little bell. It'll ding and tell you, hey, Chad's got another one coming out. Don't forget to tell your friends, especially those that are like-minded, the kids, the students that are getting into this industry.
They know what direction they want to go, but no idea how to get there. This information helps them make those decisions. Look forward to seeing you guys next time.